I'm here again with Dr. Huff, and we're going to talk a little bit about what causes tooth pain that's not related to the teeth.
Okay, so tooth pain can come from a lot of different areas. Obviously, it can come from the teeth itself. And so one of the rules we have to always rule out, or one of the things we have to always rule out is it from the tooth? So could it be from gum disease, for instance, that can cause some types of tooth pain? It could be fractured teeth, cracked teeth that may or may not be really obvious at the onset. But it can also come from other things. For instance, you can have muscle disorders that refer pain. In fact, we see that very commonly where I'll see somebody has had multiple root canals on one side of their face, and yet the pain is still there. And it's very frustrating because they swear it's a toothache. But what we find out is it may be tendonitis that's causing pain in the jaw muscles or muscle pain. Or sometimes it can even be something more ominous like a tumor or a growth of some sort, or even a vascular problem where the artery is involved that can refer pain to the tooth.
Sounds pretty complicated. So, how do you go about diagnosing that condition?
Many of these, many of the orofacial pain conditions require more advanced imaging. We do a very thorough examination. An orofacial pain examination is a very in-depth, systematic examination that we look at all aspects of your medical history or the patient's medical history. The history is the most important thing. So much of the time during our examination is spent asking questions, utilizing questionnaires, asking the same question in different ways, because we want to know more about what's actually caused that and when did it start and how did it start. So that's really the hallmark of an orofacial pain exam is the in-depth history taking. And then sometimes we need to use some advanced imaging. We often will use things like 3D imaging, which we have in the office, where we can actually take 3D CAT scans of the head and face. Sometimes we'll even refer for magnetic resonance imaging or MRIs to rule out soft tissue disorders.